Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, and rating. You can also support future episodes by making small monthly donations. Once again, welcome to the Health Flow Podcast. Are you thinking about starting your own podcast? If so, Anchor is the easiest way to make a podcast. Let me explain. Number one, Anchor is free. Anchor has all the creation tools that allow you to record your podcast and edit it right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, Google Podcasts, and many more. You can make money from your podcast with no minimum listenership. Anchor is everything you need to make a podcast in one place. Download the free Anchor app or go to anchor.fm to get started. Hello, welcome to episode number 32 of the Health Flow Podcast. I'm your host, Jean Armand. Today is February 25th, and we're at the end of Black History Month. And let me just talk a little bit about this past weekend. This past weekend, I participated in the Selma to Montgomery ride in Alabama, and it was an awesome experience. Not only was it great to get out there and get on my bike and start, the whole bike riding season and be motivated to stay healthy. It was just so moving seeing so many people from different nationalities, Black and white, riding a path that is historic for all of us. That's our history. It was moving. It was wonderful to also do it with friends and other riders that I rode with. So it was a great experience. Just had me really thinking about the future and our lives, and just our upcoming plans. This weekend, riding always gives me time to think, to clear my head, to think about future goals and aspirations, and just to review things. A time of reflection is probably the best way to say it, just a time to reflect. So I was reflecting on many things, personal and even my podcast. So I was reflecting on why I started. Why I started this podcast is because I wanted, working in the healthcare field for over 30 years, I noticed the disparity of those who know and about their health, those who actually have annual checkups, those who have insurance and can afford health care, amongst those who don't. So it's not necessarily just Black or white. I think yes, that's part of it, but that's not in totality. There's a disparity between your socioeconomic status and how you take care of yourself. And then just the lack of understanding that I would see amongst the different groups. And I wanted to be a person, as a nurse practitioner, I wanted to be a difference maker in filling the gap of understanding so that you're understanding more about your health and how to take care of yourself. It's a lot of things that people don't understand when they come into the healthcare system, and I want to be the difference maker. I reviewed all my previous podcasts. So, like I said, today's episode number 32. So, I've done 32 episodes starting from the first episode on July 23rd. And the top 2 episodes are on my episode number 3 on mental health, an episode on obesity that was done on August 20th. And also reining in is episode that I did on hydronitis. And that was episode number 24. So it just tells me a lot. Yes, obesity is a problem. Our mental health is a problem. Stress is related to so many illnesses. If you're not mentally healthy, it can create other physical problems. So I just wanted to review, just the importance of our exams, our annual health exams, the screenings that should be done, and just explain, a little bit more about that, so everyone can have hopefully a better understanding of what needs to be done. So just to start off, I'm going to really just go by what the CDC says as far as our healthy screenings that should be done. We know, to begin with, that breast and cervical cancer, really early detection is really indicative of how well you can do. So women are to be doing their own self-breast exams. So it's not just when you go to your provider. So as a female, you should be examining your own breast every month, making sure that, it could be just done in the shower, that you're not feeling any lumps, that you're not having if you're not breastfeeding, you're not having any abnormal discharge, or your nipples are erect and not inverted, unless that's how they always were, or even change in size and texture. So those are things that you should be doing, and getting your annual breast exam with your doctor. And then once you're of age to get mammograms, you should be doing mammograms. And also there's the 3D mammograms are more in depth. So those are things that you should be talking to your physician about. Of course, ovarian cancer, that's why they do pap smears, because you do a pap smear, it is if there's abnormal cells, that would prompt your physician to do further evaluation. Early detection is so important. The next thing we should talk about really is our cholesterol level. When you have your annual checkup with your doctor, your cholesterol level they're doing it, I was going to say from age 25, but even my children, I remember them when they were younger, having their cholesterol levels done, because there's actually, obesity is a problem, and high cholesterol can be in young people. So it's early detection even in there. So right now in the United States, there's like 1 in 3 American adults have high cholesterol. And if you have the high cholesterol, that puts you at risk for heart disease and stroke. Heart disease and stroke are 2 of the leading cause of death in the United States. The problem with high cholesterol is that there's no sign or symptoms. So the only way that you can know if you have high cholesterol is to get your health your cholesterol level checked. When you get your cholesterol level checked, then your doctor can go into further details, because it's the total cholesterol. Then you have your LDLs, then you have your HDLs. And so I don't want to get too complicated, but you have good and bad cholesterol. So your doctor can further explain that. And please, if you're with a physician or a healthcare provider or a nurse practitioner like myself, ask questions. And if they should be taking the time to explain to you the difference between these levels of cholesterol, because there is a significant difference, and the treatment is geared towards which numbers are high. Next thing is your colorectal cancer screening. So if you're between the age of 50 and 75 years old, you should get screened for colorectal cancer. There's some groups, they're even recommended, it's started at age 45 for people who have a known family history of cancer, of colon cancer, and other factors too. So screening is so important, so important, so important. I can't even stress how important it is. But regular screening, usually in the United States, start at age 50. Obviously, if you're having symptoms, if you're having chronic constipation, if you see blood in your stool or urine, if you're having constant abdominal pain or just things that aren't right, bloating, lots of nausea and vomiting. I'm not just talking about an episode of food poisoning or stomach upset, but even chronic acid reflux, things like that. Don't ignore it. You don't have to. That's the whole thing why you need guidance, because if you just stick to the guidelines, it may not be enough. So you need to have a relationship with your healthcare provider so you can determine when you do need these screenings, because as you've heard if you're a regular listener, you know that I've known people that had colon cancer in their 30s. So we don't want you to ignore any signs. Nausea, vomiting, bloating, abdominal pain, irregular bowel movements, could be diarrhea or constipation. Those are things that you should really get checked and decide if you need screening earlier than what's recommended. Also, know your family history, please. High blood pressure. High blood pressure increases the risk for heart disease and stroke. And once again, those are the two leading causes of death for Americans. High blood pressure is very common. Millions of adults in the United States have high blood pressure. High blood pressure is easy to be detected if you're having regular checkups, or if you follow up on symptoms that you may be having, or like chronic headaches. One of the things that you should do is definitely have your blood pressure checked, because that could be a sign of it. Not necessarily, because we do call high blood pressure one of the silent killers, because you don't necessarily have to have any symptoms for high blood pressure. Usually when you have symptoms, it's too late. You could be walking around every day with your blood pressure high and not have any dizziness or change or any headache or any other signs. So know your history. Does high blood pressure run in your family? Does mother or father or grandfather, anyone have high blood pressure, know your family history, get regular checkups, follow, if you're prescribed blood pressure medicine, take it. If you're given medicine that doesn't agree with you in some way, talk to your doctor about it. Just don't stop it on your own and decide, I'm just going to ignore it. But even before medicine, because I'm not, I'm not saying that as soon as someone's diagnosed with high blood pressure, medication should be the key. Medication, you can do things like lower your salt intake, exercise, weight loss, obesity. All those things can contribute to your stress level, to your hypertension. A lot of us, the way we eat, we don't even recognize that could be contributing to your health. Like, for example, this weekend I was observing, I knew of a person's health situation. They had had a previously mild stroke, and from their background, so they're from a Creole background, and I don't know what medicine that person was taking, is currently on, besides an aspirin, but it was a selection of foods. And of course, I'm not gonna call anybody out at the dinner table. That's not what it's all about. But unless it's close family members and friends, I might call you out. But I was just I was just mindful of the things that they were eating. Like, it would be like, oh, I want all olives, those, olives are usually high in sodium. It was like why do you need to eat 3 different olives on your sandwich? Like, black olives, whatever olives available, that person wanted it. No, I'm just saying, be mindful, stop adding salt to your food. Your taste buds really will adjust once you stop using something. Once you decrease your salt intake and you decrease even your sugar, if you go back and try to and eat those things, you're going to be like, oh my gosh, this is really salty, or this is really sweet. So just be conscious and make the little changes. There's so much that you can do. As far as our blood pressure, yes, there's, the standard. I believe now they're saying 135 over 85 is what we would like it to be, no higher than. For many years, it was like 140 over 90 is the cutoff. But if you're consistently 140 over 90, initially, that shouldn't really warrant you to be on medication. Lifestyle change, exercise, weight loss could probably accomplish it. But if you're walking around every day and you're 185 over 110, and you've done all the lifestyle changes that you can do, you're eating right, you're drinking lots of water, you're exercising, and you're still having that high blood pressure, then it's time to, be on something to decrease it. As far as, let's see, then the next thing we should talk about is oral health. Adults, I believe, my dentist recommend a checkup every 6 months, so twice a year. At least your dental health is important. You can have oral infections that are contributing to your stomach issues. It's important. I don't want us to forget that. An infection, whether it's in your mouth, if you have unhealthy gums, gingivitis, your gums are bleeding easily just as you brush your teeth, those are a sign of someone not being very healthy and something needs to be done about it. So part of preventive is you getting regular dental checkups, prostate screening for men. I believe that they're doing, so your prostate could be checked. I'll talk about the PSA. So there's a blood test called prostate specific antigen, and that measures the level that's in your of the PSA that's in your blood. So if the PSA, prostate specific antigen, is high in your blood, that may indicate prostate cancer. But a man should also, your doctor may also do a rectal exam, which you can feel a prostate. And if a prostate is hard or enlarged, those could be signs of prostate problems. An enlarged prostate may have a male not, they're urinating frequently or not really emptying their bladder like they should, just difficulty with urination. Anytime anyone sees blood in their urine, that's always something to get checked out. Your prostate could also be tender, boggy. Those are signs of infection. You can have prostatitis, which is just inflammation of your prostate. So it's really not just cancer, but it could be just something as simple as an infection. So, but it is important that men are getting their rectal exam. That's what it's called, a rectal exam annually by your physician to check for signs of enlarged prostate. You can feel if a prostate is hard. You can feel it if it's boggy or tender. So those are important things. And of course, you would then get your PSA. And that's definitely done at age 50 and earlier if there's family history. The next thing is skin cancer. So basically, skin cancer is like one of the most common cancer in the United States. And some people are at higher risk. Of course, the lighter skin, less melanin you have, then you are at a higher risk. What's important for all of us, though, is that we should actually spend time outdoors. So we do need our vitamin D, but we still, all year round, should be using sunscreen, no matter what. African Americans also need sunscreen. That's a must because we all are at risk for skin cancer. You should be looking at your skin, looking for changes. Changes such as any new growth, a sore that doesn't heal, or a change in a mole. Not all skin cancer looks the same. Like I said, we can reduce our risk for skin cancer by protecting our skin from the ultraviolet radiation all year around, not just summer and at the beach. It's all year round. I use a sunscreen on my face all year round. Kids, adults, all of us need protection from skin cancer. And just being in tune to your skin. So the two big common types of skin cancers, the basal cell and the squamous cell carcinoma. They're highly curable. So early detection, it can be cured. Melanoma is the third common skin cancer, and that's more dangerous, and that is what causes death um, from skin. That third one, melanoma, is the most dangerous one, and the one that's contributed to death. So yes, we need our vitamin D. Yes, you could be in the sun, but yes, you should be wearing sunscreen all year round. And yes, you should be checking your skin. You're the first eyes that you see yourself every day. You see your skin. Check it for, like I said, changes in moles, sores that don't heal, or they're bleeding, skin tags that look abnormal. All these things, just check it out. Um, Basically, the other things is we're supposed to be making sure that we check for HIV, and I would say when you have your annual check, part of your annual check are usually sexually transmitted disease screening. So it's not just HIV. Usually, your annual checkup include a HIV test. It includes check for hepatitis, because now we can have hepatitis, viral hepatitis, hepatitis B, and hepatitis C. Hepatitis B and C are the two most dangerous ones that are associated with cirrhosis of the liver. Hepatitis C is now completely treatable. They have a cure for that. You're tested for all the regular sexually transmitted diseases: gonorrhea, chlamydia, HSV1 and 2. So all those things are part of your annual checkup. And especially just going back to the females, untreated things like chlamydia can cause obstetric things like sterility, which could also miscarriages and things like that. So it is important that you get those checks. I mean, I believe in your annual flu shot also. I know there's lots of different conversations about, who's the only person I know who are not supposed to take the flu shots, or the people who are allergic to eggs, and or if they've taken the flu shot before and they're allergic to it. I know I've said this before, the flu shot does not give you the flu. It is a dead virus. But it takes, I would say, 7 to 10 days after you've received the flu shot for it to be effective. And if you actually are exposed during that time, yes, you can get the flu, even though you've gotten a flu shot, because the length of time was not there for you to build up immunity to it. There's over 100 strains of flu viruses, and we're not even talking about the coronavirus now. The one that the flu shot covers, influenza A and B, they usually cover the most dangerous ones. So you can still get a less severe form of the flu, of the other flu viruses out there. But people who have the elderly, the sick, asthmatics, people with chronic illnesses, anything that lowers your immune system. If you work in the healthcare field where you're come in contact with sick people, those people definitely should get it. I hope you found this helpful. I want to just encourage everyone to eat healthy. That means decreasing sugar intake, decreasing fatty foods, eating fresh fruits and vegetables, eating less processed foods. That means you're going to be cooking at home, planning meals more, eating out less, because At least when you're at home, you know what you're putting in your food, but when you're always eating out, you don't know exactly what's going in your food. Drinking lots of water, um, slowing down or just even removing the sodas intake, alcohol intake, decreasing the amount of alcohol that we intake on a weekly basis, getting enough rest, decreasing stress in your life. Oh my goodness, I can't even emphasize that enough. I know we can't always fix everything, but we need an outlet for stressful things. The more stress you keep in, the more it ages you, the more it puts you at risk for um, unhealthy body, because you're just constantly in this state of stress. It's just not good for you. It's not good for your body. Enough sleep, like I said, fresh air, exercise. All right. I hope you found this helpful. Thank you for listening. I'm here to motivate you to live the best life you can, live it healthy, just to love one another, and continued blessings to all. Thank you for listening to the Healthful Podcast. And if you have any questions or suggestions, please feel free to email me at thehealthflow@gmail.com. Thank you. Thank you for listening to the Health Flow Podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram at thehealthflow, also on Facebook at The Health Flow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.